Hello everyone, I'm Dr. Puneet Garg, consultant pediatrician from Mumbai.
I'm Dr. Aditi Gormavala, also a pediatrician from Mumbai.
In today's video, we are going to be teaching you 5 important steps on how to manage your child's fever at home.
Fever is the most common reason for children to be taken to the doctor. It is a cause of concern for parents and caregivers. But fever is the body's response to infection like viruses, bacteria, and parasites, foreign body, and injury. Fever plays a protective role in the immune system. It inhibits the growth and replication of microorganisms, enhances function of WBCs, and also antibody production. Fever is defined as an increase in the body temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit. Children have an increased metabolism and indulge in a lot of activity throughout the day. Hence, their body temperature is 1 to 2 degrees higher than adults. Hence, it is very important to measure the temperature properly as mentioned in our earlier videos, the link to which is given in the description box.
The most important step that you need to follow is to actually confirm whether your child has fever. Many of our patients who present to the OPD claim that the child has fever just by checking it with the back of their hands, but when we actually measure it with a thermometer, it shows to be normal. So kindly confirm your child's temperature with a properly calibrated thermometer, and we have described this in our earlier video, so kindly check it out. Also, it is very important that you maintain a 24-hour record of the fever, as the pattern of the fever gives the doctors a clue to the underlying conditions. Apart from fever, there are certain other symptoms present along with it that indicate how significant the fever is, such as the child may become fussy, have body ache, have a feeling of tiredness, and have poor appetite. Also, with very high fevers, we see shivering or chills, as well as an increase in the heart rate and the breathing rate. But the duration of the fever is much more important than how high the fever is going. Even in normal viral infections, the fever can last up to 3 to 4 days. So any fever that goes on for more than 3 days requires investigation as to the cause of the fever. Very high fevers are quite common even with the garden variety viral infections. So there is no need to panic. But sometimes a very high spike of fever or a sudden increase in the fever can cause the child to have a fit, which we call in medical terms as a febrile seizure, and that may require emergency treatment. It is very important to look out for certain danger signs or red flags that may be associated with fever, and if your child has any of these, kindly immediately consult your pediatrician. If the child is less than 1 year old, particularly if the fever is there in the first 3 months of life, if the fever has been going on for more than 3 days, if there is a sudden change in the general appearance of the child, normally a healthy child looks pinkish in color, but if the color becomes pale, bluish or yellowish, then you immediately need to show your doctor. If there is absolute refusal to feed and the child is not having any intake, if the child becomes extremely irritable, is crying inconsolably, has become lethargic, dull or drowsy and is not responding, or if the child has fits. If the child has a fast breathing rate and retraction of the chest wall, or if the child's cough has been going on for more than 2 weeks. If the child is having persistent vomiting and loose motions, if the vomitus is yellow bile stained, if there is blood in the motions, there is sudden increase in the size of the child's abdomen, the child has not passed urine for more than 12 hours, or if there is a documented weight loss of more than 5%, these may indicate that the child has become dehydrated. If there is any burning or pain while passing urine, or if the frequency of urine is more than usual, or there is blood in the urine, if there is rash anywhere on the body, there is pain, redness, or swelling in any part of the body, particularly in the glands and the joints, or there is any pus or discharge oozing from any side of the body. And lastly, if the fever is not responding to medicines.
So, after ruling out the danger signs, let's come to medications. So, paracetamol is the only drug which can be given at home safely. It is a suspension. Particles are suspended in the syrup. Hence, shake the bottle before using. The onset of action is 30 to 45 minutes. Wait till the action takes place before panicking. PCM will not treat the cause of fever, it will just suppress the fever. Fever might come back after the effect of the medicine wears off, that is after 4 to 6 hours. It is okay. Fever will go up and down on its own. It is important to check if the paracetamol is in drops or in syrup form, and also the strength of the suspension has to be noted. If the fever does not respond to paracetamol after 1 hour of giving it, you can also take ibuprofen. But please consult your pediatrician before taking it. Also, it is very important to not start your children on antibiotics without doctor's advice. Antibiotics can cause a lot of side effects and also can lead to resistant infections, giving rise to superbugs. In case of high fever, you can also use tepid sponging, which is a rapid way of cooling down body's temperature. With a clean cloth, sponge the whole body, not just the hands and feet, especially forehead, axilla and groin, where the blood circulation is close to the skin surface. Use long strokes for sponging and avoid circular movements or friction while sponging. The temperature of the water should be 29.4 to 32.2 degrees Celsius, that is clean, safe tap water. The water evaporates from the skin and causes cooling down of the body. Please do not use cold water or ice as it can aggravate the fever. Continue this for 15 to 20 minutes till the body temperature comes down or the child starts shivering. Please avoid doing this in newborns as it can cause hypothermia in newborns. Keep your children in low cool temperature away from the direct blast of the AC or the fan.
Children tend to lose a lot of body water when they have fever. So it is very important that you keep your child hydrated. And for this, you can give certain oral rehydration solutions like Nimbu Pani, coconut water, buttermilk, rice kanji, or commercially available ORS preparations. In the diet part, it is important to give the child light and easily digestible foods and to avoid any oily and spicy foods. Preferred foods are khichdi, dal rice, curd rice, or dalia. Kindly avoid giving your child any new foods during the illness. Also, a lot of parents ask us if they can bathe the child during fevers. So the answer is yes, you can have a bath in lukewarm water or you can use a sponge bath as well. Also, for faster recovery, it is very important that your child has a sleep of at least 7 to 8 hours per day. These were the steps that you can follow to manage your child's fever at home. We hope that you found this information useful and we'll see you again very soon in the next video. Cheers.